Today I just prepared one of the clip related to the cancer, the study of oncology, right? And we can call the cancer doctor as oncologist. So the oncologist, sometimes they kind of found cancer or chance to have reoccurrence by doing ultrasound, the MRI, or CAT scan, or even blood work. So once you have had removed your cancer cell from certain part of your organ, that you may want to see the doctor on a regular basis, like once every 3 months, once every 6 months, or once every year. It depends on the cancer that you had before. So there are kind of different type of treatment or remove the cancer cell was kind of including chemotherapy, radiation therapy, the surgical approach that kind of cut out this cancer cell or the tumor. So as I already mentioned that once the doctor found the tumor that there are two types of tumor, right? The benign and malignant. A benign tumor is not that kind of aggressive and that there's no possibility kind of metastasis to the other organs. However, if it is like kind of malignant, then from that moment, name as a tumor equals to the cancer. The cancer cell, like it's kind of a mutated cell that no one can expect where it's gonna go and how it progress in the future. So the best strategy is always recommended by the doctors, right? The type of cancer cell, so that sometimes they ask you to get some, they consider like a lot of different things, like your constitution. If you're kind of aged and very weak, then they might not do any surgical approach because you're too weak. That the risk is much bigger than the benefit. Then in that case, they just don't do the surgical approach, but they try to control the progressions of the cancer. But in most cases, if you are young and then you are healthy, then they might choose some like radiation therapy or the chemotherapy, followed by the surgical process. So in this case, the clip that I prepared today is just kind of the patient who had cancer before, kind of multiple history of cancer, and the doctor just finished the removed the cancer cell from the top part of the stomach. But recently, they just found that there's some kind of the signs that called like dysplasia. The medical interpreter should know about certain terminology here, right? So on my next video clip, we will study together one by one. However, today, let's just focus on certain medical terminology like dysplasia, endoscopic, microscopic, scar tissue, blood work, risk and benefits, PICC line, hereditary, intravenous, invasive. Those kind of terminology that we've been kind of studied so far. So please listen carefully all the way to the end. And then on our next video clip, let's just do one by one together in Korean. 예, 안녕하십니까. 유튜브 크리에이터 아른퉁 역사입니다. 오늘 제가 준비한 거는 이제 그 암과 관련된 부분인데요. 이 암이라는 거는 이제 우리가 oncology라고 하거든요. 그래서 암을 전문으로 하는 닥터는 이제 oncologist인데, oncologist도 이제 뭐 medical oncology가 있고 뭐 여러 가지 이렇게 분야가 나눠져 있습니다. 오늘 제가 하려고 하는 거는 이제 그런 분야를 하려고 하는 건 아니고, 환자분 중에 이제 여러 가지 종류의 암을 갖고 계셨던 분이 이제 최근에 위에 어떤 그런 암이 발견돼서 위암 수술을 받으셨는데 그 받았던 자리에 이제 그 디스플레이지아라고 해서 이제 변형이 생긴 거예요. 그런데 이제 변형이 이제 생겨서 이 부분이 어떻게 할 것인지에 대해서 이야기하는 그런 내용을 제가 챙겨놨습니다. 오늘은 제가 별도로 클립 내용이 좀 길기 때문에 별도로 이제 뭐 이렇게 하나씩 해설하진 않습니다만은 한번 잘 귀담아 들어보시고 그 다음에 이제 다음 시간에 저와 함께 예, 문장별로 한번 이렇게 알아보는 그런 시간을 가져보도록 할 텐데 우선은 이제 들으시면서 나올 단어들은 언제 뭐 여러 가지가 있습니다만은 이제 물론 이제 oncolog도 나오겠고요. 그 다음에 이제 dysplasia 의사분께서 이제 자세히 설명 좀 해주시면 들어보시면 dysplasia 그 다음에 이제 그리고 이제 perforation, intravenous, IV 저번 시간에 제가 했었죠. IV, PICC line, blood work, congenital, invasive, 침습적, 그런 것들, 그런 내용들 여러 가지가 있습니다. 한번 들어보시고요. 예, 노트 테이킹도 한번 해보시고, 그 다음에 다음 시간에 저하고 함께 알아보도록 하겠습니다.
So, as you know, we did an endoscopy recently and took more biopsies from the upper part of your stomach. The biopsies are showing what's called high-grade dysplasia. So high-grade dysplasia has a significant risk for turning into cancer again down the road. It would be advisable not to leave that there because the risk of cancer is significant. If somebody were completely not willing to have that high-grade dysplasia removed, one could consider doing an endoscopy every 3 months to biopsy it to see if it's turning into cancer, but that would be not the recommendation that most doctors would make. So the options that we should talk about, the most aggressive option, most definitive option, would be to have you see a surgeon to talk about having surgery to remove. I suspect they would say that you would need to have the entire stomach removed, which is a big operation. This is one option that we'll just talk about, but we'll talk about other options after this. The other main option would be to try to repeat the endoscopic resection. That would be, it would be much harder to do the resection because there is likely to be a lot of scar tissue in that area, which would make the resection much harder, and it would probably take quite a bit longer. And there's an increased risk of causing a perforation at the time that is done. And that if that were to happen, most of the time we could close it endoscopically. But there's a risk that if a hole or perforation occurred that could not be closed endoscopically, it could lead to a need to have emergency surgery that, right then and there. This is a serious condition. It's high-grade dysplasia is serious. I think it would be too risky to just leave it in there and do an endoscopy in 6 months. But some people, particularly older people who have a lot of medical problems, might decide to just leave it in there because the risk, given their age and medical problems, the risk of doing something to treat it is high. In terms of the IV, I can arrange for you, if we're going to do procedure, I can arrange for you to go to get a PICC line so that I wouldn't have to stick you in the hands and the arms to try to find a vein. It would be a better option. And so the nurses could use that special intravenous line to draw your blood and to give you medicines. But then once you were ready to go home, it could be just pulled out like a regular IV.